Hi. Hi everyone, we're going to show you today how we are planning to put in chest drains into babies using the new Furman pigtail catheters using a Seldinger technique. So I'm going to be Natalie's assistant, and Natalie is going to do one of these procedures for us, and I'll just chat you through it as she goes. So in this patient, which is clearly not a neonate, we have identified the need for a chest drain on the right side, and we are now going to place the catheter. I'm going to actually open the pack for you first.
Yep, and before our sterile field, we would have established our landmarks.
Okay, good.
So,
and remind me what those landmarks are.
So we would have gone from the sternomaneuveral angle into the second intercostal space, and then palpated down to the fourth intercostal space in the mid-axillary line.
So mid-axillary line, fourth intercostal space.
And then when we insert, the needle will be going above the rib so as to avoid the neurovasculature bundle.
Excellent. Good guide for where the fourth intercostal space is. It's roughly in line with the nipple. Mm-hmm. Okay, so sort of in line with the nipple, mid-axillary line. Okay, shall we just show folk? Well, let me get sterile and pop. So Natalie is preparing the air cleaning, and then if you have time, you would infiltrate with local anesthetic, and then let us just show you what we've got in our pack. So in the pack, there is the pigtail catheter. It's called a pigtail. You see the little curled up end. A dilator. A Seldinger guide wire. A Seldinger guide wire that's sometimes called J wire. A needle. An attachment for the underwater drain, and a three-way tap. Yeah, so it's really good at getting air out because they've got much smaller holes, not so good at getting blood and fluid out, so we would really only use this for air.
Okay, so this is a sterile field, and we're examining
the needle in a horizontal position, and it runs you through the skin, applying some negative pressure until when you hit the pleura you'll feel. Can you feel a little bit of? Do you feel a little release? Yeah. So a bit of air comes out. Okay, then your syringe comes off. Good. And yeah, I'm here to assist. So I'll take that from you if you like.
Thank you.
Okay.
And we need to insert the.
Okay, so now you take your Seldinger wire, and that will stay in position. But if you like, I can hold that in position for you. So just this advances a little bit forward to get rid of the little J. There we go, and fits into the end of the catheter nicely, and that advances to about 5 centimeters of that in the chest, and that will be plenty. Okay, and then it is absolutely vital that you have a hold on the guide wire, someone holding onto the guide wire at some position all the time, and that's where the assistant really comes in. Useful. Keeping the Seldinger wire sterile is really difficult. Okay, so the Seldinger wire is in. So then your needle comes out, holding onto the Seldinger wire all along. Okay, and then I can hold there for you. Okay. Right. And then let me hold there, because you generally need two hands. The dilator then is passed over the Seldinger wire. Right, so once you've got it there, and then that is used to dilate the skin, so you just needed to get it into the, yeah, so that, and you want to just get that tip through and into the pleural, into the chest cavity. And usually a little bit of a rotation will help it to pass more easily. And once you've dilated that, you can retract the dilator. So then the dilator comes back out, leaving the Seldinger wire in place. And again, this is where your assistant comes in handy. So you can let go there. I've got that. And this can be quite fiddly. So Danielle, if you want to just see, so Natalie's just passed the tip of the catheter onto the guide wire, and then once it reappears on the other side, so we just need to pull back a tiny bit to advance until you can you see the,
yeah.
There we go. So have you got the guide wire on that side?
I do, yep.
So then I'll let go on this side. And if you like, I can then hold the guide wire here.
That's okay. Yep.
And what you will see is it just needs a little bit of a twist and a bit of gentle pressure, and the pigtail catheter makes its way through the soft tissue. And in a preterm baby, this then will go to the first marking, first black marking, which is there, and in bigger babies, perhaps a centimetre or two further in. Okay, your pigtail catheter is then in position, and then shall I hold the catheter?
I'm happy with that.
Are you happy with that? And then the Seldinger guide wire is removed. We would then secure that. And what we want is, in a pneumothorax, we want the drain within the chest to be angled slightly anteriorly, so the drain on the outside of the chest to go initially in a downwards direction. And we'll just do that first bit over there, and then that chest drain then gets attached to an underwater drain that we've used before. The bottle gets filled to the line with sterile water to keep the drain below the level of the chest at all times.